Friends, you working as a counselor is the greatest gift for those parents who are coming with children with a disability. When a mother comes with a child with clubfoot, she has so many questions. She's coming with so much of anxiety. But when she sees a counselor willing to listen to her, it gives extraordinary relief for her. So counselors are active listeners. Remember that. Counselors also have to speak and guide them. So this topic is customized counseling. You know, there are 4 different clubfoot: idiopathic, syndromic, neuropathic, and postural. So imagine when you talk to a idiopathic child's mother, you can definitely say that, don't worry, the child is going to be all right. But imagine you're talking to a mother who has a syndromic child. You know, syndrome. Drome means home, like aerodrome. So syndrome means home for many symptoms. The child has clubfoot, child also has so many other problems. So you won't be able to tell that, no, your child is going to be all right. So you have to be very careful. You have to customize. And maybe a child with spina bifida, neuropathic. You have to be very careful. You have to help the mother understand that child may undergo a surgery to remove the spina bifida before the clubfoot treatment starts. So you have to customize. If it is just a postural, no need to tell them that the child has to be, in the follow-up for 5 years, child has to go for tenotomy. No need, because postural do not require tenotomy, because the problem is only in the midfoot, not in the hindfoot. So for midfoot, only just 1 or 2 casting, the foot is corrected, and some doctors may suggest for few weeks or months of bracing. So you have to customize. Imagine now you are also counseling parents with other disabilities. So the kind of counseling, listening, and the kind of sharing you do for a child with a disability with a clubfoot is different from a child with other disabled conditions like cerebral palsy, visual challenge, hearing impaired. So you have to customize. And also remember, if you look at this one page that is given here on page number 49, it talks about celebrating possibilities. When you work with the parents, you have to understand what is disability. It is explained here. And in the role of counselor, beautifully it is mentioned, there are 3 different areas you have to focus. One is counseling during the medical care. When the real medical treatment is going on, you have to relate to the parents in a different way. When you counsel, the content of the counseling and the way you listen has to be different from when the child is going through the rehabilitation, because counseling during rehabilitation is different from counseling during the medical care. And also counseling during the education, counseling for education, to make sure that the children are getting into Anganwadi or pre-primary school, the counseling has to be different. So learn this technique of customizing the counseling based on the situation of the child, based on the medical condition of the child, based on the physical challenge of the child. You have to customize based on which phase the child is. During medical treatment, there is a different way you have to approach. During the rehabilitation, there is a different way you have to approach. During the education of the child, you have to approach differently. So learn this. It's not that all size, one size fit all. No, you have to customize. You have to customize based on the child's situation, and I'm sure you'll master it. We are here to help you. We are here. Let's learn together, and I wish you all the best, because we want to see that you are a very successful counselor.